Hello, 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 everybody. Well, today we have a very nice case. We have a patient with cholangiocarcinoma and invasion of the cystic duct. So we have a very big gallbladder, very distended gallbladder, and in these cases, we perform a prophylactic. We will perform a prophylactic gallbladder drainage because of our study published it already in an abstract, and now will be published in a few months in a full paper regarding how we need to deal with this patient, because many of these patients in the follow-up perform cholecystitis. So we need to avoid this cholecystitis, and what we showed in our study when we randomize the patients, we saw that patients well were not drained. They perform cholecystitis at least in 20% to 30% of cases. So we need to deal with this and avoid that these patients coming back to the hospitals. And this patient is unresectable cholangiocarcinoma. So this patient needs just a palliative treatment. So now I will show you the technique. I am using an Axios, a hot Axios, and I am using a Pentax ultrasonoscope J10 series. It's a 4.0 millimeter working channel. So you can see here the tip of the Axios. I am already connected. So once you are in the position, we go inside the gallbladder, and then we need just to deploy the Axios. We perform the second step, that is opening it. You see, it's very well opening. And then we need to push, push, pull back, as you can see here. Ahí va un poquito. Okay, so you need to see this angulation between the Axios and the middle part of the Axios to be sure that you will deploy very well. So what I do is to deploy inside the working channel. So in that way I am sure that I will deploy the Axios in the gastrointestinal lumen. You see here the endoscopic image, and the Axios is already open. So I will freeze. I will show you here. This is the Axios inside, and this is the Axios in the lumen. No sé si podamos ver la imagen endoscópica ahora. So I remove, and we finish. No veo bien la EPKI, ¿eh? No es la EPKI correcta. So we see very well that the Axios is well deployed, and the patient already have an stent in the biliary tract. So now is decompressed the gallbladder, and this patient can be sent home ambulatory. It's not necessary, to conserve the patient inside the hospital. Okay, so this is what I want to show you, how to do a gallbladder drainage, and it's doing from the antrum. You see, the antrum is here. ¿Podemos ver la EPKI o no? Okay, now we see. Now you see better. Okay, so you see the Axios there. So we are in the antrum. Very well. Okay. So I finished the transmission, and thank you for joining us. We will show you better cases in next days if we have. Thank you so much.